In today's video, we're going to dive into 5 common misconceptions about glaucoma, misunderstandings that could put your vision at serious risk if you don't have the full picture. Many people believe that if something were wrong with their eyes, they'd notice right away. After all, wouldn't there be clear warning signs like blurry vision or eye pain? This is one of the biggest myths about glaucoma. It's often called the silent thief of sight because it gradually steals your vision without any noticeable symptoms. By the time you realize something is wrong, up to 40% of your vision may already be gone, and it's permanent. There's something even more concerning that you need to know. Your doctor might not be giving you all the facts. Glaucoma is the second leading cause of blindness worldwide, yet millions remain unaware of the true risks, the limitations of standard treatments, and the steps they should be taking now to protect their eyes. The reality is, the medical system often reacts to glaucoma once the damage has already begun, instead of focusing on preventing it from happening in the first place. This is exactly why it's crucial that you hear what we're about to discuss. In this video, we're going to uncover the 5 biggest myths about glaucoma, misconceptions that could cost you your sight if you fall for them. And even more importantly, we'll share what you can start doing today to slow the progression of glaucoma, protect your optic nerve, and reduce your risk of blindness. This isn't just about debunking myths. It's about giving you practical, actionable steps to make a real difference. Stay with me until the end, because what you don't know about glaucoma might be more dangerous than you think. Lie number 1. Glaucoma has clear warning signs. Many people assume that if something were wrong with their vision, they'd notice right away. You'd think glaucoma would come with obvious signs like blurry vision, eye pain, or headaches, right? But that's not the case. This is the first and one of the most dangerous myths. Glaucoma is known as the silent thief of sight, and for good reason. It sneaks up without any warning, slowly stealing your vision over time. By the time you realize something's wrong, you could have already lost up to 40% of your sight, permanently. What makes it even trickier is that glaucoma doesn't start by blurring your central vision. Instead, it begins at the outer edges, gradually shrinking your field of view in ways that are almost impossible to notice in your day-to-day life. For example, you might be crossing the street and not notice a car coming from the side. Or you could be reading, and whole words seem to disappear from your peripheral vision without you realizing it. That's the sneaky way glaucoma works. Your brain tends to fill in the missing pieces, so the problem stays hidden until it's too late. But here's the question: why don't doctors warn patients about this more aggressively? The issue is that most routine eye exams only check your eye pressure. If your pressure is normal, doctors might assume everything's fine. But that's a dangerous oversimplification. Glaucoma can still develop even when your eye pressure is within the normal range. If your doctor isn't carefully checking your optic nerve and peripheral vision, they could easily miss the early signs. The key to protecting your vision is being proactive. Don't rely on just an eye pressure check. Make sure you get a comprehensive eye exam that includes optic nerve imaging and a visual field test at least once a year. If you're over 60, have diabetes, high blood pressure, or a family history of glaucoma, don't wait for symptoms to appear. Glaucoma doesn't wait, and neither should you. Here's a quick test you can do at home. Cover one eye and look straight ahead. Can you still see clearly in your peripheral vision? Or do parts of your sight seem to be missing? If something feels off, it's time to get checked. Now that we've debunked the myth that glaucoma comes with clear warning signs, let's move on to another dangerous misconception: the belief that only high eye pressure causes glaucoma. If you think you're safe because your pressure is normal, you might be in for a surprise. Lie number 2. Only high eye pressure causes glaucoma. If you've ever had an eye exam, chances are the doctor checked your eye pressure with that little puff of air test, the one nobody likes. And if your eye pressure was in the normal range, they probably told you, everything looks good. But here's the problem: glaucoma isn't just about eye pressure. This is one of the biggest misconceptions out there. Yes, high intraocular pressure is a major risk factor for glaucoma, but it's not the only cause. In fact, you can have glaucoma even with completely normal eye pressure. It's called normal tension glaucoma, or NTG, and it's far more common than most people realize. So what's really going on? Glaucoma isn't just about pressure, it's about optic nerve damage. And your optic nerve doesn't just suffer from high pressure, it can also be damaged by poor blood circulation, oxidative stress, and even inflammation. Think of it like a garden hose. If the water pressure is too high, it can burst. But what if there's nothing wrong with the pressure, yet the hose is still drying out and cracking? That's what happens to the optic nerve in NTG. It can weaken due to poor oxygen flow, nutrient deficiencies, or underlying vascular problems. So why don't doctors emphasize this? Because most glaucoma treatments focus solely on lowering eye pressure. The go-to solution is usually medicated eye drops or surgery to reduce pressure. But if the real issue is nerve health and circulation, then just lowering pressure isn't enough. So, what can you do to protect yourself? Supporting your optic nerve health from multiple angles is key. Start with your diet. Leafy greens like spinach and kale, antioxidant-rich berries, and omega-3 rich foods like salmon help fight oxidative stress that damages the optic nerve. Regular exercise can also make a difference. Activities like walking, yoga, or even lightweight training improve circulation to the eyes, reducing the risk of optic nerve damage. Managing your overall health is just as important. If you have diabetes or high blood pressure, keeping them under control can significantly lower your risk of developing glaucoma, even if your eye pressure is normal. If you've ever been told, your eye pressure is fine, so you don't have to worry, don't take that as a free pass. Glaucoma can sneak in even when pressure levels are normal, and if you're not paying attention, it could catch you off guard. But what if I told you that glaucoma isn't just something that happens randomly, that you can actually take steps to prevent it? That's exactly what we're diving into next. Lie number 3, glaucoma can't be prevented. If you've been told that glaucoma is inevitable or just bad luck, that's a dangerous myth. While genetics can increase your risk, there's plenty you can do to lower it. Glaucoma doesn't have to be a one-way ticket to blindness. There are proven ways to slow its progression and even prevent it, and they all start with your lifestyle choices. The problem is, the medical system is largely reactive. It focuses on treating glaucoma after it's already developed, not preventing it in the first place. Plus, with glaucoma treatments being a multi-billion-dollar industry, there's little incentive to promote natural prevention strategies. But the truth is, simple changes in your daily habits can make a significant impact. Your diet plays a major role in eye health. Eating antioxidant-rich foods like berries, leafy greens, and omega-3s can protect your optic nerve. Reducing processed foods and unhealthy fats can help lower inflammation that could damage your eyes. Managing stress and getting quality sleep are equally important, as chronic stress and poor sleep increase your risk. Even everyday habits, like screen time, can affect your vision. Too much screen exposure causes eye strain and oxidative stress, which can harm your optic nerve over time. Using the 20-20-20 rule or blue light blocking glasses can help. So no, glaucoma isn't inevitable, but waiting until you have it to act is a mistake. Start taking steps now to protect your vision. Lie number 4. Glaucoma medications are the only option. When diagnosed with glaucoma, most people are handed a prescription for eye drops and told to follow up later for possible surgery. What's often overlooked is that medications aren't the only solution, and in some cases, they may not be the best one. While eye drops can help lower pressure, they don't necessarily stop glaucoma from progressing or protect the optic nerve. The side effects of glaucoma medications can be unpleasant: burning, stinging, blurry vision, and dizziness, to name a few. Some medications only lower eye pressure, leaving the underlying nerve damage unchecked. And while they can be helpful, they're not the cure-all many people think they are. Fortunately, there are alternatives to medication. One is selective laser trabeculoplasty, SLT, a non-invasive laser treatment that drains fluid from the eye, lowering pressure without the need for daily drops. It's effective, quick, and relatively painless, often providing long-term relief. If you're struggling with medication side effects, SLT could be worth discussing with your doctor. Nutrition also plays a critical role in eye health. CoQ10, magnesium, and ginkgo biloba are just a few nutrients that support optic nerve function and may help slow glaucoma progression. These supplements can work in tandem with conventional treatments to protect your vision and provide long-term support. Lastly, lifestyle factors like limiting screen time can reduce oxidative stress, which exacerbates glaucoma symptoms. Using blue light blocking glasses and practicing the 20-20-20 rule can also relieve eye strain. Glaucoma management doesn't have to be limited to eye drops. There are many holistic approaches worth considering. Lie number 5. Once you have glaucoma, you're doomed. Hearing the words "you have glaucoma" can feel overwhelming. Many people leave the doctor's office thinking, "That's it. My vision is doomed." But that's simply not true. A glaucoma diagnosis does not mean inevitable blindness. This is another myth that needs to be shattered. Yes, glaucoma is a progressive disease, meaning it can get worse over time. But it's also a manageable condition, if you take the right steps early enough. There are people who have lived with glaucoma for decades and still maintain functional vision. The key is taking action now to slow its progression and protect your eyesight for as long as possible. So, what can you do to keep glaucoma from taking over your life? It starts with strengthening and protecting your optic nerve. One of the best ways to do that is by following a daily eye health routine. Think of your eyes like a muscle. You wouldn't expect to stay strong without exercising, right? The same goes for your optic nerve. Small daily habits can make a big difference in preserving your vision. Eating foods rich in lutein, zeaxanthin, vitamin C, and zinc can provide essential nutrients for eye health. Simple eye exercises, like palming, rubbing your hands together and placing them over your eyes, can help relax eye muscles and reduce strain. Staying properly hydrated is also crucial. Dehydration can thicken the blood, reducing circulation to the optic nerve, so aim for at least 8 glasses of water daily. Speaking of circulation, many people don't realize that poor blood flow is a major factor in vision loss. If your blood isn't efficiently delivering oxygen and nutrients to your optic nerve, it weakens over time. Simple habits like gently massaging the area around your eyes, particularly your temples and the bridge of your nose, can promote blood flow and relieve tension. Using warm compresses in the evening can also relax the muscles around your eyes and encourage better circulation. And of course, movement is key. Walking, stretching, and light yoga can prevent blood stagnation and improve overall circulation, which can help slow glaucoma progression. Another important step is staying informed. The world of glaucoma treatment is constantly evolving. New medications, therapies, and even potential regenerative treatments are being developed. Keeping up with the latest research can open doors to better management strategies. Joining online support groups, following medical podcasts, or reading about cutting-edge treatments can help you stay ahead of the disease and make informed decisions about your eye health. So no, you are not doomed. You have options. You have more control over your eye health than you may have been led to believe. The key is taking action now, before irreversible damage sets in. Now that you know the 5 biggest lies about glaucoma, the real question is, what are you going to do about it? Because knowing the truth is one thing, but taking action is what truly makes a difference. Glaucoma is not a hopeless diagnosis. It's not something you can afford to ignore. And it's definitely not something you should leave entirely in your doctor's hands. Your vision is your responsibility, and the steps you take today could mean the difference between keeping your sight or slowly losing it without realizing it. So here's what you need to do right now. Schedule a comprehensive eye exam. If you haven't had one in the past year, don't wait. Early detection is everything when it comes to protecting your vision. Start incorporating vision-protecting habits. Eat more leafy greens, take care of your blood circulation, and reduce screen strain. Small daily changes can have a massive impact over time. Stay informed. Research on glaucoma treatments and prevention is constantly evolving. The more you know, the more control you have over your future eye health. And one more thing, don't keep this information to yourself. Share this video with a friend or family member who needs to hear it. You could literally help save someone's vision today. Now, let's talk. What's your biggest concern about glaucoma? Drop a comment below and start the conversation. Your experience could help someone else. Before you go, make sure to hit the like button, subscribe, and turn on notifications so you never miss another life-changing health tip. And if you want to keep learning how to protect your vision, click the next video on the screen. It's packed with even more eye health secrets you need to know. See you there.